seen or heard of Grey's Anatomy? Okay, so have you ever imagined yourself being in like a really awesome surgery and you're saving this person's life, like Dr. Shepard or Dr. Grey? Because I have. I do that all the time. Whenever I watch that show, I always wish, like, man, I wish I could do that stuff. I wish I could be a surgeon and not have to look at Chris doing that. And it's really fun and interesting to me to like be in there and like saving someone's life. So today I'm going to show you how to do one of the most basic things in the medical field, and that is giving a simple interrupted suture stitch. So this is what it looks like. Obviously, a banana is a good practice tool because like when it's just like barely getting past like the green stage, the skin of the banana is pretty close to a human's. So the first things you're going to need for giving stitches, usually this is in like a really sanitary environment in like an operating room and all that. But usually you'd have a sanitary area, which is like this rag, which came from the hospital. And then you're going to have a needle driver, which you're going to use to clamp your needle with. You're going to have some surgical scissors. You're going to have a simple nose clamp, and then you're going to have forceps. Obviously, all of these will not be used. They'll be brand new, but these are used. And then, of course, you're going to need your needle. This is not a real suture needle. I just grabbed it. It's like for sewing holes in couches, but it's bigger, and I don't want to use my real suture needles because those are actually kind of expensive. And the thread, I just grabbed regular thread, but usually it'd be, can you even see that? It's the moving thing. It's usually thicker and it's more durable. So first up, what you're going to want to have is your banana. That's going to have a wound in it, and I didn't bring a scalpel because that's considered having a knife in school, so I'm just going to cut it with the scissors. So there's your wound. So first thing you're going to want to do is you're going to take your needle, just like this, and you're going to take the pointy part of it and point it towards you. It's just a little easy thing. Then you're going to take your needle driver, and you see how it's like bent like that? You want the bend so that it's pointing up, and then you're going to unclamp it, come down here to about half the needle, and then clamp down, 2 clicks. Now this clamps down on its own so you don't have to hold it, and then you're good to go. So then once you have that, you're going to take your forceps, and you're just going to want to kind of like hold the skin in place. Usually in human skin it'll like be moving around, but the banana's connected. So you're going to want to take about, not quite 1/4 of an inch, but a good amount of flesh, and then come up on the other side. Oh, not that far. On the other side of the banana. 1 second. So obviously this is like really crappy because I've used it a bunch of times, but you want to come up out on the other side of the banana, right about like that. So once you're through, you're going to unclamp it. You can set down your forceps. And then, so the tip of the needle's through, so you're just going to kind of grab that and pull it through a little bit more. And then you're going to grab it again at the half, 2 clicks, and then pull it the rest of the way through. Now, because this is a curved needle, you want to be careful not to just try and drag it through. You want to go with the curve of the needle. And usually your thread is a lot smaller, and you stop and then refill it, but I didn't want to do that, so I just have a really long needle. Now you want to stop pulling through so that you have a bit of a tail left. And then what you're going to want to do is you're going to, usually you have surgical gloves on, so what you're going to do is you're going to unclamp your needle. You're going to set your needle driver aside for a second. You can set your needle down. Then what you're going to do is you're going to pick up your needle driver again, take the long end of your string right here, and you're going to wrap it around twice around your needle driver head. So just like that, 1, 2. Then you're going to take the tail, being careful not to pull it through, like the other side of the banana, and then you're going to just pull it through that loop you just made, like that. Now with this, it just kind of creates a quick little slip knot sort of, and then you want to pull it tight. It's going to come loose when you let go, usually, but that's fine because what you're going to do is you're going to take the thread, wrap it around 2 more times, grab, my hands are like shaking because I'm nervous. You're going to grab it again, and then when you pull it tight this time, it'll stay. So you've done that twice now. All you do is you do simple ones where you just wrap it around once, come down here, grab your thread, 1, once again, and then 1. And then this is still a sanitary area, so you can set your tools down. You're going to grab your surgical scissors, and then you're just going to trim the ends off. Now usually you trim them like a little bit nicer than that, but in this case, it's just kind of going for it. So I actually had to end up giving stitches to someone, a real person, at one time. I was about 13, I think, and my dad was on a logging crew, and he was out. My job with him and the logging crew was just to like attach the chain on the logs and then get out for the skidder and then get out of the way. But at one point my dad accidentally got his hand caught between a chain, and it ripped like part of his inner like finger open, like right in there. It like ripped it open. And we were out in the middle of nowhere. Like the rest of the logging crew had like left, and we were just out there finishing up a little bit. And so we were the only ones out there, and he was bleeding pretty bad, and it was going to take too long to get to the hospital. Like he probably would have lost his finger. So what we ended up having is we have a first aid kit in the truck at all times, and we have like a little sewing kit in there. So I ended up having to give my dad about 3 stitches in his hand, and he didn't have any Novocaine. He didn't have any like pain meds out there, so he just kind of had to sit there while his like 13-year-old daughter was giving him stitches. So basically, giving stitches is pretty simple, and it's one of the first things you learn in medical school. Gosh darn it. Obviously, I'm not like the best at it right now, but I'm getting there. So for those of you who aren't like, call that good. For those of you who like aren't interested in the medical field, you don't actually have to do this. It's really fun to just kind of sit there and like pass time with it. But if you're not interested in the medical field, you can just eat the banana. And but this is something I'm really interested in, and I really want to go into the medical field. And simple things like this just kind of get you one step closer to your goals of being in the operating room. So thank you.